So, for those of you who don't know who I am, my name's Dan West. I work at the Department of Health. I'm the Chief Digital Information Officer for Health and Social Care in Northern Ireland. You're all very welcome here to our Digital Dispatches 8. So the purpose of these sessions, just for a bit of a recap, is to recognise that the impact of the pandemic requires us to think a little bit differently about how the HSCNI team, the Digital Health and Care Northern Ireland team, keep our brilliant colleagues across the health and care system updated on our thinking and priorities. The team themselves have pivoted a little bit during the pandemic to be more of a delivery-focused group. And we can't run the great big meetings with lots of people coming in person to share perspectives on digital that perhaps we had once done. So these are a bit of a step in for that in terms of how we communicate with our colleagues. We had the first one of these for those who remember back in sort of May, June time, last year, where we heard from some AHP colleagues on how digital adoption had changed and been accelerated during COVID. We also covered in the September one of these digital dispatches sessions a bit of an update on the Encompass programme, which I ran myself at the time with some support from Lynette Crooks, who you can see on here today. So I'm delighted to be joined again by Lynette, who's the Senior Programme Manager on the Encompass programme, as well as Dr Dermot Hughes, who is the SRO, the Senior Responsible Officer for the Encompass programme. Kevin Conway, I think, should be on with us as well. There he is, who's the Senior Executive Support for the SRO and the programme team. And the goal of the meeting today is to, in the midst of the Omicron wave, or at least our preparations for it, is to give it a bit of an update on the Encompass programme, how we're getting on, what the priorities are, and some of the great progress that's been made in the last 6 months of last year. So I'm not going to say anything more. I'm going to hand on to Dermot, Kevin, and Lynette, and they're going to take the microphone and run this session here today. So thank you, and Dermot, over to you.
EPIC are an internationally renowned IT healthcare system that is implemented across what I call centres of excellence in the United States, and now in Europe, in 6 centres in the United Kingdom. The United Kingdom is more pertinent to us, and that is an NHS-based process. They're implemented in Manchester, Cambridge, University Hospital College London, Great Ormond Street, London, and Exeter and Devon. And what we learn from that is that all the information structure are made available to the next implementation. And so we are really literally standing on the shoulders of giants. It means that we don't have to reinvent the wheel, and we bring the best possible care to Northern Ireland. It's about asking doctors, nurses, pharmacists, social workers to work collaboratively together across Northern Ireland to decide how care should be delivered. And we will do this in partnership with general practitioners, but also in partnership with patients. And it's really about revolutionising care. It's not simply recording what we do now, but it's deciding what's the best way forward. The EPIC Encompass tool will ensure that we can have access to social determinants of health, so we know where services should be commissioned, and we know where the best value will be made. We will be replacing multiple current systems within the healthcare family, and it's a daunting number, which have evolved for very good reasons over a long period of time, but we will be involved with 1,700 interfaces to give you some quantum of the work that's involved from the technical aspect. We will replace many of these systems, and we will have a unified single source of truth and knowledge. We will get better governance. we will get better outcomes for patients, we will get better involvement by patients, and we will be able to bring lots more relevant information both to universities for research and development, and hopefully as well to our local industries who are very interested in supporting this project. While it is an IT-enabled project, it is really about changing healthcare, and for that reason, we are funded from the transformation budget. We're not perceived to be simply an IT system. It will not be without its challenges, and getting everybody to agree what is the best way forward in Northern Ireland has historically never been a very good, simple ask, but it is a really worthwhile task. So that's my take on the process, and that's why I'm involved. I'm involved to change healthcare, to make things better for patients and clients. And the enabler is IT. IT will change healthcare the way it's changed every other aspects of our life, be it banking, be it travel, be it how we consume information, be it how we consume our leisure time. But this is the largest healthcare IT project in Northern Ireland, and possibly the largest IT healthcare project in the UK. We're different from elsewhere in that we include acute care and social care. That is a very unique aspect of our system in Northern Ireland, and it's something that we will have a comprehensive cover of all patients within Northern Ireland. So I'll hand over to Lynette and Kevin.
Thanks, Dermot. So I'll just play on what Dermot was saying there and give a bit more information about how this will actually change things for our service users and our staff. So we've all been working for a long time in terms of bringing in systems and bringing in changes to try and make things easier for our patients and service users. And obviously, from my perspective, previously working on ECR, we've done some of this to a degree, and hopefully we can build upon systems like that and make this better. So we're talking about less repetition for patients, stop and telling people the same thing over and over again because they're all working from the one single central record, improving the quality and consistency of the care. So evidence-based standards and increasing ownership. So we will be introducing a patient portal, which I appreciate some patients do have at the minute for specific conditions, but this will be a Northern Ireland-wide patient portal. People can start to take ownership of their own health journey and information, and improve safety. So obviously bringing in these systems, particularly in the likes of meds, etc., we're increasing the use of digital safety checks. So we know that people are getting the right information to be able to deem what treatment is required. For our staff then, we're obviously going to reduce the amount of paper records and the amount of time trying to find them when they're in somebody's locked office or in a record room somewhere. Hopefully giving more time then to treat our patients and service users, giving them easier access to the record and all the information they need to be able to get that better relationship with their patient and better information. Safer, better care. So the intention with Encompass is to create a regional system, so regional standardized workflows that will be implemented across all of Northern Ireland. So in alignment with that once for Northern Ireland approach. There are very few areas of the system that this won't impact to varying degrees. It's going to change things for everybody to some way or another. If we look, whether that's a social worker being able to see the social determinants of health and be able to share those with others, or analysing performance, or just a porter getting his instructions digitally to be able to understand what patients to pick up and where to take them to, there is an impact on everybody. And we need to make sure then that obviously as we go through our implementation, that people, as we design the system, that people know what those changes are, what that impact is going to be, and how we prepare for that. So where are we now? There are a number of main phases of the programme. We started off with a pre-work phase, which obviously took us from our contract signed, just getting all the groundwork in place, getting our plans, getting our governance structure set up, doing a lot of work with Epic in terms of our legacy systems and processes. How do things work at this point in time? and then obviously getting some of our core underlying pieces in place as well. We did move then into workflow walkthrough in September of last year. Hopefully a lot of you were able to attend the workflow walkthrough event that we held, or have subsequently seen the videos that were recorded to get a real sense of the system that we're going to be putting in and the benefits it can bring to us here in Northern Ireland. We are currently in the middle of that workflow walkthrough process. We have done a couple of build waves. We had been running decision groups for a number of months now, which involves, subject matter experts from across the organisation, from across a wide range of roles and areas, helping us to review that foundation system that Dermot mentioned, determine whether it matches what we need here in Northern Ireland, or any changes that we need to make to the workflows to make it work for us and our service users. It's probably worth noting, and Kevin, you may want to jump in at this point, just where we are now, and what Dan said at the outset of the meeting around COVID, and particularly at this point in time, the Omicron variant, and the impact that that's having on our frontline services, our clinical facing services, and in relation to staff getting sick and not being able to work. We are looking at this point in time, and we've just had our programme board, and we are looking at taking a bit of a pause in some aspects of the programme. So that is the reduction of those clinical work groups that require subject matter experts from across the service to provide input, which allows them then to work on their clinical facing positions, or indeed their administrative duties in the trusts. Kevin, I don't know whether you want to add anything specific else to that.
Yeah, thanks, Lynette. Hello all, my name is Kevin Conway. For those who don't know me, executive support for Encompass, supporting the SRO in the program. I started here at the end of August, and so I've been with the program for several months now, and have learned a lot in those months. To Lynette's point, as we're in this design workflow phase of the program, this is a clinical and operational program. This is an IT. It's IT enabled, but it shouldn't be led by IT. And with that being said, we can't do the design and workflow discussions without our key clinical partners from all the trust. And being a good partner in that, we realize that the impact that the COVID variant is having on not only each individual trust, but you personally, because we understand like the infection rates are even higher, that staff are missing work due to illness. We've decided to do a pause for January and February for the Encompass design groups and focus content groups, just to be respectful of those individuals. It doesn't mean the other paths of our work streams within Encompass are slowing down. If anything, they're doubling down. It gives us an opportunity to continue moving with our infrastructure procurement. It gets us able to start working with our data migration and integration teams. We are going to continue with our communication plan and strategy, and looking at what the change impact will be to the workforce. So a lot of work is going to continue in parallel. We will reassess every few weeks to see, how the COVID response is as we work through with our clinical partners. But right now, that's the game plan coming out of program board just 30 minutes ago. So I think if you have questions, what I'm excited about today is like hearing some questions from the groups. My belief is Encompass is the biggest program in Northern Ireland, just based upon size, scale, and complexity. I think it's important for us to be leaders and keep the communication lines open for all. We are in the process of finalizing our website. We just finished some penetration testing this week, which was a huge win in milestones. We've had several, what I would like to consider wins over the past several weeks. We still have some challenges in front of us around recruitment and some other items that we're still working through, both on the Encompass program and at the trust level. But overall, we're super excited around 2022 and see how much we can get accomplished over the next 12 months. So Lynette, I'll turn it back over to you at this point.
Yeah, so just to close off, I suppose, on this slide, there obviously are a number of pieces of work still to be done to get us to the point where we actually are implemented across the region. The dates on this, need to be reviewed and amended. But ultimately, we need to make sure that everywhere we're going, the staff are trained, prepared. And this isn't, I suppose, like any other system. There are going to be a high amount of hours required of training for a number of users. So we need to make sure we've got all of that in place. Everybody knows what they're doing. The systems are all tested. Our contingency systems are tested, and everything's validated and is going to work day one, which, as you can see, we're going day one go live is in SET, and then moving on to Belfast Trust. Hopefully, as part of conversations now, we'll also be looking at that final order of the last three trusts in conjunction with other programs who are obviously also implementing major programs to these organizations, such as the labs and radiology projects. So hopefully we'll get a decision on that, and we'll look at the best way to take that forward. As I mentioned earlier, this is a regional solution that we're implementing across Northern Ireland and all the trusts. Once we've done that, we will go into an optimization phase. So while we will make some changes to the system as we go through, making sure it's clinically safe and we're catching all those sorts of items, there will be things that we cannot do up front, and that we would push into that optimization phase where we can go back and redesign or add additional workflows or forms, etc., to enhance the system and make it the best it can possibly be. In terms of the system to begin with, we have outlined an initial scope in our business case, which hopefully you will have seen at some point before. For some of this, there's replacement functionality. So as Dermot mentioned earlier, there are a number of systems that we're replacing. There are some that we will run interfaces to, but it covers the majority of areas across our system, including community and social care and mental health. There will be new functionality largely brought in. So as I mentioned earlier, the patient portal, e-prescribing and medications administration, order comms, and clinical support. So a lot more being brought in with this. And you'll see there then the systems that we aren't putting in as part of the system, but we'll work very closely with and link with, which is our labs, our radiology, and our GP systems.
I don't think we can undercut, Lynette, the importance of the continuing of the records between community, social care, and secondary care. I mean, we will be the first large organization in Europe to have that continuum of care, whether it starts in the community setting and then gets referred into an acute site, or whether it starts in the emergency department and then goes into more of a community care or social care at the home level, integrating that with the patient portal so patients can actually control and navigate their records, book appointments, etc., look at their medical records. This is a wonderful opportunity to really evolve Northern Ireland in front of most countries that are actually wanting this functionality. If we can prove that this will work at Northern Ireland, this will be the template for most countries, including our other countries within England and Scotland and Wales, to adopt this process. So I can't underestimate underemphasize the importance of Encompass and the excitement that there should be around Encompass, because this is monumental. I mean, this is a once in a lifetime opportunity to have such a huge investment, not only from a financial point of view, but from a clinical input in how we care and treat for our patients in Northern Ireland. I just wanted to touch upon that in that diagram you just had up, because all those boxes just show like boxes. But until you tie all the different boxes together and see the interchanging and the intersections of all those critical areas, things like order comms and e-prescribing. I mean, if we can eliminate medication errors by prescribing, what a great benefit that is for you and your loved ones. So again, I don't want to underestimate the work that goes into it. It's a lot of work, but it's going to be super exciting coming out of the end of this and the benefits that we'll get from it.
Yeah, I'd just like that. It's not an electronic record. It's a smart system. It's layered with prompts, safety checks, and supports to staff. The patient portal will radically change how we deliver care, in that patients will be partners in care. My background is in cancer services, and we routinely would have given records of conversations or records of outpatients appointments to patients, and truly they become partners in their own care and responsible for lots of their own care. And this is how we perceive the process will be supported through EPIC and through the Encompass project. The other really important thing is that we will be provided with near real-time data, which is a huge governance leap. Too often in Northern Ireland, we're facing retrospective look-backs or inquiries into what happened, simply because maybe we weren't au fait or over the detail of the data. Now we will have near real-time data for all patients and all aspects of their care.
Thanks, Kevin. Thanks, Dermot. Yes, and in terms of that, then population health, using that data, not only that you have it immediately to treat your patients, but how do we use that to understand our population needs better and get better outcomes across the whole service. The next slide does just sort of reiterate what this means for staff roles. It is important probably to note that at this stage we don't know all of the impacts. As we move through our design sessions, we'll look at what the new workflows are going to be and how that actually impacts staff. But it'll be later this year then before we have that idea. And we'll be able to then obviously work with the services to understand how we can change that and skill people up where necessary to do the shift in their new job. It's important also to note that there are no planned job losses as a result of Encompass. This is about receiving upskill training to be successful in a new way of working, not in any losses in terms of roles themselves. And as I mentioned earlier, everybody who needs access to the system will be trained robustly to make sure that they know what's happening on day one. There's labs set up to make sure you can tailor the system so it works for you and your processes, so that you can get the absolute best from the system to do your job. Kevin, were you going to jump in there?
Yeah, I mean, around the training piece of that, I mean, we're looking at a very robust training program, both in classroom and maybe some virtual sessions, some skills lab, not only before conversion, but also immediately afterwards. So I think with training, I encourage you all to get engaged early on. I mean, we're going to be out there soliciting and really recruiting for some additional super users across all the trusts. Any chance that you have interest in being a super user, you get some additional training. I think it's a great opportunity to get engaged with Encompass in the near future. But the training piece of that, the adoption comes from training. So it's important that everybody attends training, everybody ask questions during training. Your jobs may be impacted by us implementing this. That's okay. We will get the robust training plan and sessions in place for you, and we will have elbow to elbow support during conversion as well. So we'll be rounding the units in the different areas, and we'll have a team in place to help support each conversion as we go through.
Also then, just to say, obviously we've got a central team, and we've got teams in each of the trusts who are supporting the delivery of this programme of work, but there is a huge amount of input required from across HSC and our arm's length bodies to make this work. So we have a good governance structure in place now. We've got Dermot on board as our SRO and chair of our programme board. We have good structure set up in each of the organisations in terms of their own local boards and readiness groups to make sure that any changes that we're making or any plans that we have to put in place for the likes of training and preparedness for this are getting picked up and managed. And then we have, through our design authorities, advisory groups, and when we kick back off, we will then also have focused content design groups as well. So we're talking over 200 groups of staff from across HSC helping to design, build, test, train, implement this system across the region. Just to finish off in terms of the slide deck then, hopefully again you'll have seen this before. If not, we have a video that just sort of summarises what Encompass is about. And just to point out, we are also hopefully in the very near future launching our own Encompass website so that we can provide more information as we move forward with the programme and keep you up to date on that as well. Happy then to move back to Dermot, Dan or Kevin, or to start looking at questions maybe that have appeared in chat or questions that anybody has. I'll stop sharing.
Yeah, brilliant. Thank you, folks. Maybe the best thing to do here now is just if the presenters there, Dermot, Kevin and Lynette, try and curate some of these questions that are appearing in chat, and anybody else who's in the audience, do feel free to either add to the chat here or put your hand up or just come off mute and jump in with any questions you might have. Let's start with some of those questions in chat. Maybe Lynette, if you want to just compare that for us.
Yeah, so there was a question just there. I know I'd mentioned the videos about workflow walkthrough, and Fergus, just for everybody else, has put the link in chat, just if you want to take a look at that and take a copy of that. So you can access those videos and get a real sense of the system that we're putting in. We've a question from Frank. What about transition of patients from children's services to adult services? And I see Dermot has replied to that. So the system will follow the patient from birth right through. So it is one record for the patient. And obviously we just need to make sure that the information that's being held or transitioned or shared is the right information for the people treating the patient at any particular point in time.
Yeah, those workflow walkthrough videos, Lynette, if you wouldn't mind me speaking up on those.
Yep.
For those who have not watched those, and to see the end-to-end journey of a patient is delightful. I mean, if you haven't seen the Epic system and see the patient journey throughout all the different modules, it is worth your time to review. I can honestly tell you it took a lot of time to kind of package up those videos to get them out to the public. You would think it was a simple task, but it really wasn't. So we're very proud of getting those videos out there for anybody to review, and I would encourage all to go out and take a look at them. Very good content there.
So we also have a question in from Linda about what is in place for outreach to public as the core users of our services, and links with training organisations who provide our future staff. So for both of those things are obviously very important, and we are putting plans in place to make sure that we pick those up. We have already done some initial groundwork with our universities here in terms of getting Encompass, even as a general piece, onto the curriculum, so they understand what's coming. And then we'll obviously work with them in terms of how much training we can do in advance of rotations through our organisations or subsequent long-term employment with our organisations, so that people, when they come on site, can hit the ground running and start treating their patients. So that is important. In terms of members of the public, that piece of work probably hasn't fully kicked off yet. We've obviously done some initial comms, but it's probably something that will be a big focus in the next year, ramping that up, making sure people understand what's coming as part of a wider communication about all things HSC and HSC digital, because it's not just Encompass, it is a lot of other pieces that feed in and make this service what it is. So that communication will pick up, making sure that people understand what it means for them, what it means in terms of access to their records, data protection, GDPR, etc. Making sure all of those things are picked up. And we do have a number of work streams that will pick that up and look at that impact. And we are also looking to include service user consultants within our groups and meetings, and use forums that already exist with our patients and service users where possible, to get their input into the design and feedback where we can.
I would agree with Lynette. We need to pick that up a little bit more in 2022 to engage the public. And part of that is the communication plan, right? We need to get some additional communication plan out, not only internally, but externally. So Brooke Kroos and Victoria are leading that piece for us. And we've seen great improvements with communication over the past 60 days with their engagement now that they're on board. And we continue to press upon that in 2022.
Yeah, I've just noticed a question about death certification and review there from Catherine Collins. The EPIC will design to replicate the NICR function where you can collate a death certificate and review it. And it will also replicate the need for M&M meetings and multidisciplinary meetings. So it will replace the functionality that currently resides to a degree in NICR.
I also see that John asked about, thanks for the update, 30-minute briefing. These digital dispatch meetings are great to have. I believe Dan said he hosted one in September. We're hosting one in January. I'm keen to continue doing these. I'm keen to having town halls. We are open and transparent of where we stand, and we want to continue spreading as much information as possible through all of our trust leads and through the Encompass teams about what's going on in Encompass and the status and updates. So I'm happy to ramp that up more if needed, or keep more of a quarterly basis as we have right now. I'm open to all kinds of ideas.
Yeah, I guess each trust also has its own communications channels and kind of staff updates and all hands meetings and whatnot, where Encompass will naturally feature. Certainly for the South East Trust, who will go first, I would imagine that's more likely than for those trusts in the kind of 3, 4, 5 positions in the deployment schedule. But yeah, I don't think we can over communicate on something like Encompass. I'd be happy to do a quarterly thing in amongst all of the other digital dispatches work that we're doing, just to keep people up to date, as Lynette was alluding to just a moment ago, on the wider digital portfolio. Encompass is one of our major programs, not the only one. So yeah, happy to do that for John and others. But I would also encourage people to just look out for those local communications as to how the Encompass application will be rolled out in your specific organizations.
Thanks, Dan. Thanks, Kevin. There's just a couple of other questions that we have in chat. So Stephen's asked what accessibility features are we putting in place for clients and staff with disabilities. So I suppose, as has been mentioned before, this is a system that's being used across the globe. And obviously these considerations have been put in place, but it's worth noting that we have a full run of testing, service user, testing, etc., that will happen to make sure that this works for everybody who needs to access it. And we'll make sure, obviously, that all of our staff, regardless of their needs, can access the information that's required.
I know the Northern Trust have already done some work around the patient portal and seeing if it met the needs of the Disability Forum, and they were very happy with the level of support that was available. I think the patient portal will radically change how we deliver health services and the nature of our health services. I was saying another question about NICR functionality, and as trusts go live on Encompass, there will be less use of NICR, but we're very clear that NICR is currently the backbone of the clinical service, and that will remain functional until Trust 5 is implemented. So there will be a requirement for a period of time to run a duplicate service.
Thanks, Dermot. Just obviously, you were talking there about go live. There is a question about, is the delay expected to affect go live dates? That is something that obviously over the next number of weeks we need to look at this impact and what that means for our go live dates. And we've taken an action over the next few weeks to pull that together and present that to our next programme board meeting. So again, we will keep everybody informed about any shifts in terms of that.
And also too, we're going to work really closely with some of the other larger programs, such as the NIPIMS and NIPACs projects as well, as we look at it from the digital portfolio level, and to see how any delays within or pauses within Encompass impacts any of those other programs. So like Lynette said, there's a lot of coordination and work happening over the next few weeks. Once we have more concrete information, we'll be happy to share that.
Yeah, and also just supposed to add to that, we're conscious obviously of a number of end of life systems and the end points of those, and we're taking all of that into consideration as well, to minimize any risks to that, namely our patient administration system in 2025, etc. So all of that is fed into the conversations about our timelines. I know there's a couple of things about people being keen to learn more about a specific service and how they've been managed. It's maybe better if we pick those up and just take those offline and share information, and just focus on the questions. Understand the emphasis on training before go live. After SET is live, who or how will ongoing training be delivered? It's probably worth pointing out, I suppose, for each trust implementation, we have pre-go live, go live, and then we have post-go live phase. And there's about 6 months at this point in time in between each of our go lives to allow for that, obviously support post go live for each organization, but also then a bit of in parallel working to commence the sort of training and preparation and pre-go live activities for the next organization. So obviously we need to make sure that that's all resourced effectively, and we can manage that and make sure everybody gets the support they need pre and post go live as we move through.
The benefit is the content will be completed, right? So the content of the training content will be done. We know that there'll be new hires, new staff coming on board. And so that ongoing training and getting those new hires onboarded will be needed to happen at every trust. As we go from trust to trust, we'll have the capability of refreshing our training domains. We will also have the capability of refreshing our training materials and content so that we have the most up-to-date, refreshed information that's out there. So I think that's training never ends. It's ongoing. Pre-go live, post-go live, it never ends. It's always there.
I think it would be fair to say that the real selling point for Epic is their training, and they believe that this is a clinical skill, and that while there's some at distance information gathering and learning, the training is real time, face to face, near the working environment as possible, and the investment in training makes implementation successful, and that's very clear. And that will be the ethos for the project. Often people implement projects and the training and support isn't as it should be. This will not be the case with Encompass, because to make it successful, we do need to have expert users, and we will ensure that that's available to all staff.
Okay, a couple more questions. I see there was a question around GP system replacement, and Donna has replied to that on our behalf. So GP systems obviously are outside of scope at this point in time, but there will be obviously interfaces with that critical sector to make sure that they have information that they require from secondary care and vice versa. And there is a question on functionality to link associated family members, e.g. mothers, to their infants. Kevin, I don't know whether you want to pick up from your previous experience. I know there's obviously some things that we would specifically need to look at in terms of adoptions, etc., and how that works. But Dermot, you're coming in, are you?
Yeah, we're specifically looking at this in social care, where it's not traditionally a medical record as a person-specific medical record, but in social care, it may well be family-specific, and that's the current practice in some of the parish systems. So we're trying to look at that functionality at present for the social care aspect of the program, where people are, it's a family record, and therefore that might be possible. So that while it's not in scope, it may possibly become in scope.
I think I've picked up all the questions. If I have missed any, could somebody put their hand up and let me know if I've missed your question?
I think we've done a pretty good job on that, of rapid fire questions and answers here. So yeah, I think we're caught up. I've been double checking, making sure we've answered everybody. But if we have missed anyone, please feel free to.
Or obviously, if there's questions
come
after,
online and ask the questions too. We're not afraid of seeing somebody's face and open up your camera and asking your question either. It doesn't always have to be in chat. So feel free.
and it doesn't have to be in this forum either. You can ask us
Yes.
questions outside of this as well. We'll be happy to.
I suppose
help out.
one thing we haven't touched upon is that there's an extensive app library which you can apply to the data that's kept within the system. So you can have very high level management tools. You can get public and system-wide health information. You get social determinants of healthcare, but you can also get professional specific information. So it's very useful for professionals who are doing ongoing revalidation and they're meeting their professional requirements. And it will be a huge resource for research and development information. And it has huge potential on a system-wide basis.
Nobody else wants to show their face.
Yeah, we might be at the end of the questions there. Thanks, all colleagues, for your attention and for the questions that have come through in chat.